Hi, everyone. We're back.
Right. And just to start off this month's DocuMentors, I just want everybody out there, this is not an optical illusion. I did trim the beard.
Yes.
Not because I got any negative comments whatsoever. Well, a couple. But let us know if you like the beard at this length now. And let us also know that you're happy to be here and listen to our presentation tonight on the pros and cons of corporate dentistry.
Yes, I'm Dr. Ivy Peltz.
I'm Dr. Eric Studley.
So please also just get your friends involved, all of your dental friends. Please tell them to go to Facebook and watch this and participate. We're looking forward to your questions. Hi, Rashmi.
So if you do have any questions, just type them in there and
Yes.
We're more than happy to answer them. So today's presentation.
Before we begin our presentation, we're going to have a little disclaimer. And our disclaimer is that we fully intend to promote Doccupations at some point during this presentation. So be warned.
So tonight we're going to be talking about the pros and cons of corporate dentistry, but the topic will also morph into not just corporate dentistry, but also private dentistry, because so many of the parameters that will come into play where you might consider that to be a disadvantage of working for a corporation, it's really just what it is like working for somebody else.
Yes.
So, and we are really not taking the stance of, yes, we are for, yes, we are against. We're really just putting out the information that's out there.
That's our second disclaimer.
Right, as biased as we can. So,
unbiased.
Unbiased,
yes.
Unbiased as we can. So when we start talking about, why corporate dentistry, things have changed so much from when Ivy and myself graduated, when somebody graduated 20 years ago, 10 years ago, even 5 years ago. So the options as well as the licensure are so different now that the advent of corporate dentistry really becomes a pro for so many different aspects. We talked about in a previous that the licensure is accepted in so many more states. So it gives that new graduate the option to go to so many more locations. And we find that the compensation that a new graduate can get in a corporate type of position is much greater than they would get, let's say, if they worked for 2 or 3 different dentists, 4, 5, 6 days a week.
Are they also more likely to get benefits in a corporate practice?
Yes. So one of the things that you see in a corporate, they will give you a package. You're an employee, but because you're part of a corporation, there are benefits that you will get. Some will pay towards your malpractice insurance. You'll get health benefits. They might give you short or long-term disability insurance, life insurance, a 401k plan.
What about health insurance? Is that included?
Not always.
Mm-hmm.
And one of the things that you should find out, try to negotiate for some of these things. Some of them may not give you health insurance, but they'll give you a stipend, a dollar amount to pay towards the health insurance. They will also give you money towards the CE courses. And a lot of the corporations now are actually doing in-house CE courses. So just by working with them over a certain period of time, you'll get the credits that you need to renew your license. And lastly, a lot of the corporations, depending where the locations are, will give you a sign-on bonus, as well as a sign-on or / move-in bonus.
So are those benefits harder to get with a solo practitioner?
It's almost impossible.
Okay.
Because a solo practitioner, overhead is a very big concern, and they're just running on a different type of schedule.
Yeah. Anyway, that's a nice starter package, you know.
I
to
think
go to
so.
A corporation, so.
I mean, we see some of these contracts with some of the corporations with compensation starting at, 150,000
Right.
on a guaranteed pay.
Yeah.
That's
pretty good.
That's a pretty nice start.
You know, I always used to tell my students when I had them that when they got out of school, they'd be earning more than me the moment they got out of school.
Well, average starting pay is
There
about
you go.
150,000 for a new grad. So,
Right.
What's also really nice, the corporations, because they have a large size, they are often willing to sponsor citizenship. And that is a very important thing for a lot of our graduates, as well as they'll pay legal fees and have the attorneys that can handle this because they're versed in this.
Mm-hmm.
So having the right immigration attorneys working with these corporations to help the new grad for sponsorship is quite important.
That's probably almost not possible to get in a solo
with a solo practitioner, once again, not as versed. To them, it could be quite difficult.
Right.
So, that corporation, that sponsorship is really worth a lot.
Mm-hmm.
Also, your ability to treat your family. I've seen it in the contracts where it says you're allowed to treat your family. You pay the lab expenses, but that would be anywhere. The corporations also are so up to date.
Mm-hmm.
Their equipment. And I know our students graduating, they're coming from high technology, really nice equipment.
Plus, who doesn't like that?
Right. And it is. It makes you feel good. It's like, a new car.
Right.
So being able to work in a facility that has up-to-date equipment also, which is very important, that the corporations are very state and federal compliant because they are so large and they treat such a large population. They really stick to the state compliance, as well as federal. Yes. Well, I get a little nudge there. It's like maybe you should breathe for a minute or something.
How did you know I wanted to say anything?
So one of the other things that I like, because when I got my first job, I wanted to be the owner within the next month or two.
I think this is what I was going to say,
right.
Is that it gives you the opportunity, I believe, to pick and choose which of the tasks you enjoy in the ownership of a dental practice, if you get to move up. So things are a little more divided into different staff people in a large corporation than they would be in a private practice. So if you really hate the managerial skills, you can elect to be the clinical supervisor or something like that. There are a lot of different roles that are available that you might be interested in.
Right, and that's something that you may not have available or wouldn't have available if you went in with a solo practitioner.
Right. Any questions out there?
I see a lot of
We see a lot of familiar faces.
A lot of familiar faces out there.
It's nice to see. So along this same theme, tomorrow, if you check your social media, if you haven't liked Doccupations, please do. And you will see tomorrow that we're going to be promoting an article written by Roger Smith. And the title is Which DSO is Best and How to Get Hired by Them. 6 Simple Rules to Follow. So if you're getting interested in the possibility of a corporate position, you might be interested in reading this article about how to get a job.
And Roger's written for us a few times, and
yeah.
he writes really straightforward stuff.
And it's very interesting, a very different perspective than you might be used to.
Right.
So any other pros
to lastly,
corporate dentistry?
One of the nice things with having corporate dentistry DSOs for the existing practitioners. So the young practitioner who gets into the practice, and now as you start to move on in your years, it's now an option for, depending on the type of practice that you have, for a DSO to come in. You sell your practice to them, and you stay on and work with them, and now you just get to do the dentistry.
That's nice.
It's kind of like you go full circle.
Yeah.
It's you got into dentistry just to do the dentistry, and you get to leave dentistry just doing the dentistry.
That's
so
nice.
You leave with a really good taste in your mouth.
Yeah, I want to do that.
Right, that would be a nice thing.
That
So
is nice.
those are really, just a few of the benefits of corporate. And once again, it really depends on the person. But once again, keep in mind, whether you're working corporate or for any dentist as an associate, you relinquish certain things until you are the owner.
Right. So what are some of the cons?
Well, some of the cons, right? Well, when you sign...
Until now, we've only told you the pros.
Right. Well,
so
you always want to
hear
start
cons.
with the fluff stuff.
Yeah.
I
usually deliver bad news first and then the good news.
Really? I think if you do the good news first, at least as a guy, if you tell me the good news first, I'm listening. If you tell me the bad news first, I'm not going to listen to anything after that.
Thank you for the tip.
So
good to know.
That's
See,
one
you
of the
can learn
cons.
all kinds of things here on Documentors.
That's one of the cons.
I never knew that.
It's one of the cons of being in a relationship. So one of the negatives of signing with a corporation is that they do require that you sign a contract. And anytime you sign a contract, it really it gives you limitations. You are an employee, or you might be an at-will independent contractor. But under that contract, there are still certain rules and regulations that you will have to follow.
Can I interrupt? I actually have a question. I have heard the terms DSOs and MSOs banter about, and I'm wondering what the difference is, and secondly, if it makes a difference to me as an employer if I work for a DSO or an MSO. Is there any difference?
No, it really is. It goes by size.
Mm-hmm.
Like the MSO has up to, depending, and I've heard like up to 10, and then the MSO starts from that one. The DSO starts and goes from 10 or 12 and up, kind of thing. But whether you're working for an MSO or a DSO, the contract is going to be exactly the same. So, and that contract really is something that is legally binding. So when you sign that contract, it's not something that you can change your mind tomorrow. Yes, you can change your mind tomorrow, but there are going to be regulations that you're going to have to follow. One of them being, you may have to give 90-day notice. You may have to give 120-day notice. And some of them have stiff penalties. If you don't fulfill that 90 days, some of them will state you owe them $500 per day if you go short of that.
And they enforce that, don't they?
And that's enforceable, because someday when you're the business owner and you realize when you lose a provider, you realize how much money you're actually losing.
Right.
And it's a lot more than the $500 a day that your employer is losing. Also, as an employee, you lose your autonomy. So your schedule is going to be made for you. You're going to be told the specific hours. You're going to be told your on-call schedule. You're going to have
vacation time.
Vacation time is going to be an exact amount. And they may even state that you can't start a vacation time unless you've worked here for at least the first 6 months.
What is the usual amount of vacation time for a first year?
I've seen contracts anywhere with 1 to 2 weeks, paid vacation. So my recommendation, try to negotiate at least 2 additional unpaid vacation to get a total of 4 weeks vacation if you can. As a dentist, you need it.
Right.
But you'll actually have to ask for the vacation time. And some of the contracts say you have to give at least 30 to 60 days advance notice of when you want to take off.
It could be quite limiting.
Yes, but there's a reason why you're getting paid $150,000 to work. Nobody's getting it for free. So, you are giving up certain things. Also, the staff that you will have, most likely you'll have nothing to do with who is working for you. Not only that, the other dentists that are working in the practice with you, you probably will have no decision in that whatsoever as well.
Right.
So you're going to have to learn to play well with others because it's not going to be your choice.
Right.
I know we all graduate and we feel, yes, we are the decision makers, but now you're going there and you're going to be that employee, and that's the status that you're going to have.
So if you guys think you didn't like us telling you what to do,
right.
Wait till you have a real boss.
And they're, excuse me, and they're the ones that are signing your check.
Exactly.
So they have a lot more to say.
Yeah.
Also, a lot of the places where you're going to work, your patient population, the types of patients or the types of dentistry that you may want to do, you may be limited because the practice that you're working in accepts a certain type of insurance, and those insurance plans may not cover those procedures, so you may be limited by what's covered.
Or the supplies that they order, or I remember when I started practicing, believe it or not, this is, I hate to admit it, it does date me quite a bit. You didn't have to wear gloves back then, but I always did anyway. So when they did enforce the law that you had to wear gloves to practice dentistry, my boss gave us 1 pair of gloves per day, and we had to wash them for the whole day. And that was just horrible as far as I was concerned, but it wasn't my decision. I didn't get to decide these things. So that's what happens when you're an employee and not the boss.
I think also, going, especially as a new dentist, especially coming from dental school, where supplies were more or less unlimited. And you will also realize,
a rude awakening,
exactly.
Too.
And also the quality of the supplies that the dental schools use.
Right. Yeah.
So, that becomes...
For example, the gloves that in the dental school where we were previously working, those are very, very expensive gloves.
Yes.
I don't buy gloves that quality in my office. Mine are fine. They're absolutely fine. But they're not like that. The rubber dams. I've never. These are really good quality supplies that you guys are used to, and then you go to an office and they give you an Explorer to carve an amalgam back in the day, and so, that's the extent of your equipment.
You're going to have to learn to, work
improvise
with sort of what's there.
Yeah, improvise. Who do you typically report to when in corporate? Good question.
So a lot of the way the corporate is set up, there may be a senior dentist or the managerial dentist that's there, but there is also an office manager. And for a lot of the corporate places, the office manager is the one that's really running the show, because that's the person that's answering to the managerial dentist and to the corporate dentist.
Right.
So it really is no different, though, once you own your own practice, or anyone who really runs our offices.
Right.
Our office managers. So they are extremely versed people, the office managers.
Speaking of office managers, if you were looking for one, where would you go?
I would go to Doccupations.
So
oh my God, got that little
coincidence.
plug in there, huh?
Yeah, I said I was going to do it.
Right. So what are some of our other cons with the contracts with the corporate dentistry?
You tell me. Gotcha.
So we talked about how appointments are scheduled for you, and that could be, good or bad. So you guys leave dental school and you're used to having, 2.5 hours to do a single surface restoration. Now your patient schedule is going to be based more or less on units of 15 minutes. So you're going to be given, 45 minutes to an hour. You'll be given a side book for an adjustment. So your pace is going to have to change. But I must tell you, do not work to the pace that you are not comfortable with.
Mm-hmm.
So if you cannot finish to the right standard in the time frame, do not. Because regardless of anything, it is still your license, which leads me to another point. Some offices, you may be given a treatment plan,
Mm-hmm.
and you may not necessarily agree with that treatment plan, yet you're told go in and perform that treatment. Well, if you disagree with the treatment plan, you should really stand up for that, because if you treat the patient in regards to that and it wasn't to what you felt was right, you are just as liable if it turns out not to have been correct.
I think I may have mentioned this in a previous DocuMentors, but in my first year out of dental school, I had 6 different jobs. I kept leaving jobs because I was being asked to do things that I really didn't think were the right thing to do. And one of my bosses told me that it wasn't necessary to look at both sides of the mouth when doing a treatment plan, because caries was bilateral. So I left that job pretty quickly.
Mm-hmm.
A couple of my friends continued working there, and they got into some type of Medicaid issues because he had used their license. So that's another, that's a whole other topic.
Right.
Also, we do have a question. Is Doccupations regional? East Coast, West Coast? Yes, we are national.
Yes, we're bi-coastal.
So please sign up.
So also with the corporate type of setup with the patients, sometimes it might be difficult to form relationships. Although now most of the corporations are having continuous care, comprehensive care, meaning that if Dr. Studley started the patient, Mrs. Smith, then the patient continues to go with Dr. Studley.
Right.
Some, though, and this is very important that you ask this on your interview, will I be, have continuous care with the same patients? Because it really is so much better for you and also so much better for the patients. And that's kind of how we've taught you to do that.
And what if you want to leave?
Well, that's the thing. So with signing that kind of contract, the restrictive covenant. So number one, yes, you can leave, but as I mentioned earlier, there'll be a time frame. And I, once again, have seen a 90-day, 120-day. I have actually seen a contract where you could not terminate your employment till after 1 year.
That's crazy.
That's ridiculous. But these contracts also put a penalty if you do. So once again, if you have a 90-day termination and you quit after 30 days, you owe that corporation $30,000. And once again, they will enforce it. So, we mentioned this at the very beginning, that the pros and cons of corporate are not necessarily the pros and cons of corporate dentistry. I like to think of it.
I also think we left out one thing with corporations. Sometimes you may have more mentorship. It seems
That's true.
Almost counterintuitive. You would think in a private practice you would get more mentorship, but often private practitioners are very busy with their own patients and they don't necessarily have the time to provide the kind of mentorship that new dentists are looking for. And the corporations actually, some of them, you have to do your research and figure out which, some of them incorporate some pretty robust mentorship into their programs.
Right, we've spoken and we've been on orientation programs with some of the corporations, and some were quite impressive because so many of our new dentists are really looking for that mentorship. And unfortunately, when you work in that solo practitioner, you're too busy.
Right.
And that solo practitioner has to produce, you have to produce, and they're too busy to help teach you.
Exactly.
Whereas in the corporate, most of them now are setting up as a mentorship type of program. And, just getting back to, once again, working for somebody, if that's been your goal, it could be a nice career. Myself, Ivy, we kind of always wanted to go out on our own from the very beginning.
You're bossy.
So, it's once again, whether you're working for a corporation or whether you're working for anybody, you're still going to lose that autonomy. You're still going to lose the ability to just make your own decisions. That's why I worked for, a bunch of dentists for about a year,
right,
and then just picked up, and gave it a shot. And it's a quick little cry, but it's a great climb once you start opening your own practice. And I highly recommend that if it's something that you want to do, that you start looking at that after you're working for anybody for a period of a year. And use that year working for anybody as a giant CE course.
Yeah.
Learn your practice management skills, learn your dental skills, learn your people skills.
Exactly. It's a great learning experience if you just use it that way. Especially because you may not be busy every moment of the day with dentistry at first. So you're going to have to keep yourself busy. So you might as well be learning something while you're there.
Right. Learn the codes, learn how, they're doing the billing, learn how they talk to patients, learn how they deal with the vendors. There's so much that you can learn while you're there.
Yeah. It's nice seeing all of you. We see a lot of familiar names, and thank you so much for joining us with Doccupations today. Our next Documenters is July 10th at 7 o'clock, and we're going to be talking about how to find and why you need work-life balance, which I think is ridiculously ironic that we're going to be talking about that, but okay.
So thank you so much.
Thank you. It was very nice spending this time with you today, and we'll see you next time.
Have a great night.